to go back to the day centres and respite, if I could, to Deputy Minister Butler. And I welcome that there's progress being made on it, but I cannot understand how quicker progress can be made a year and 3 months after a pandemic was declared, a year and 2 months. So you know the facts and figures on the ground. The vaccination has been rolled out. So can we have more specifics in relation to day centres and particularly in relation to respite? And I'm repeating again, I said on the last occasion, I don't think it's my role to go to a minister about a specific case, but I'm going to have to. I don't want to, because everybody should be treated the same. So people are going under in a care centre, in a caring role with no respite. Just very briefly, when do you envisage that we will have respite resort and day centres?
Thank you very much, Deputy. In relation to respite, and you raised this issue again with me last week, I have looked for a comprehensive report in relation to respite in the Galway area, because respite is happening in other areas, and I will furnish it to you as soon as I get it. I've answered the question in relation to the daycare centres. Work is underway, the task force is in place, but it has to be safe to do so. 393 cases again today, so we are trying to be taking a cautious approach. We want to open them and not close them again. I understand that, and I understand that you're actually doing your best. But, you know, we're talking about minimum prices for alcohol and other things that are irrelevant at the moment. So the effort of government should be going into identifying vulnerable groups, essential services, and restoring them as a matter of priority. So that's what I'm asking you. I welcome that you followed up on it, but I'm telling you, I just checked before I came here earlier on before 5 o'clock, and Merlin Park has stopped respite. Day centres are not functioning in Galway, so we need clarification on that. So thank you for that. Minister, in relation to the rollout of the vaccination, I believe that you have been put in a position where information has been segmented, and I'm unhappy with that. I don't blame you for that. You're doing your best in this limited role. I think we need an overall discussion. I was called disingenuous by the Taoiseach when I said this wasn't happening. I'm repeating, it's not happening. There are so many elements that we can't even get to discuss here. Vaccination is only part of it. And trust is an essential part of it, and I think trust has been broken. And I pay a tribute to the people who nevertheless persist in believing in a system as best they can. So the age group 60 to 69, I've heard no apology from anybody. It's been raised by other TDs here today. To be told you're going to the bottom of the list is simply appalling and unacceptable. I use those words again, and I hope I'm using them with sufficient force that you might look at them. In relation to that age group, to be told you're going to the bottom of the list, somebody as Professor Kingston Mills, gone back at the end of April, pointed out, amongst many other things, that the Medical Council guidelines make it clear that recipients of medicines, including vaccines, have a right to make an informed choice and should be provided with all the information necessary for decision-making, including details on possible adverse reactions, efficacy and alternatives. Now, I'm in a position as a TD where I'm making representations to a health executive saying, this person has contacted me, they want to be vaccinated, but they don't want the AstraZeneca for very good reasons. And they have nobody to discuss that with. They're at once at the mercy of the GP. Some GPs are very helpful. Other GPs do a sales pitch for AstraZeneca and say you've no choice. That's unacceptable. That's not a way to build confidence in relation to the rollout of the vaccination programme. There are two other quick things, well, they're not quick actually. One is in relation to temporary accommodation for healthcare workers. It's arisen again in Galway. It's arisen prior to this, and RTE has raised it and TDs have raised it. Healthcare workers coming from direct provision centres in temporary accommodation, and now their temporary accommodation, they're told they have to get out of it. In fact, in Galway, in 2 particular cases, they got a letter to get out by the end of July. They haven't got out because they've no place to go to. So, on the one hand, we're saying the temporary accommodation is there for the duration of COVID, as long as we have it, and yet it's been interpreted in a manner that's totally inconsistent, unfair, when we really need healthcare workers. The final thing I want to raise is in relation to the waiver of intellectual property right. And the Biden administration has shown the way, finally, which is very, very welcome. And our own President, Michael D. Higgins, has said it marks a moment of immense moral significance in international policy, putting global need ahead of any narrow considerations. And you have said that personally you're looking at that. And I welcome that. However, we're now a year, 3 months into a pandemic, and this was something we should have looked at the very beginning, and Ireland should have been leading, because we knew
given our background, that we were all in it together. That's what we were told. And now we have the very, very upsetting scenes from India, who producing vaccines, exporting vaccines, and people dying in the manner that they're dying. Now, my colleague Joan Collins raised it, I raised it, other colleagues have raised this, and we were laughed at in terms of waiving the intellectual property right. Now, the point of the TRIPS, as I understand it, was to fill a gap in the market, where to encourage innovation. And you can't encourage innovation where there's too much risk and there's no demand. All of those risks have been taken away. Why? Because we gave them an indemnity. We've given all the pharmaceutical companies an indemnity. We've taken away the risk factor, and there's absolute demand. And we are now in a situation where we're bolstering their profits at the expense of human beings who are dying on the street. That is totally unacceptable. And we should be leading the way. Our voice from this small country should be leading the way to say, let's look at this. It's not good enough to tell us today it's not a panacea. I don't want a panacea. I don't want perfection. But I want a country that's leading us with the voice of humanity and not for profit. If we're putting all our eggs in the one basket, which I disagree with, because I think we need a multi-approach, then at the very least remove the profit element. Finally, in my last 6 seconds, we had a very interesting Zoom meeting with the Cuban representatives of the Cuban government the last day. They've produced 5 vaccines, or they're in the process of producing 5 vaccines. This is my 3rd time raising it with the government to say, what have you, there's an embargo. Can you imagine under an embargo and a non-profit situation, they're working on 5 vaccines that want to come to fruition with a very low death rate. Any debt is unacceptable, but the deaths only happened when they opened up their country and they've admitted foolishly and prematurely. Thank you.
Thank you.